Here we go. Hello, and thank you for watching this program on how to do a Medicare self-audit. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to be legal advice. Target coding does not work for Medicare. Target coding does not work for Strategic Health Solutions. Target coding does not engage in providing legal services. We are not affiliated with Strategic Health Solutions or Medicare at all. CPT is a registered trademark of the AMA. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it is not guaranteed. Just a little bit about myself. Again, my name is Dr. Marty Kotler. I am certified in CPT coding. I'm a certified professional compliance officer. I've written many books and training manuals for chiropractors and physical therapists on billing, coding, and documentation. Been helping thousands of chiropractors nationwide with compliance, especially when it comes to billing, coding, and documentation. Been training thousands of chiropractors over the last 12 years on proper Medicare billing, coding, and documentation. I'm a featured speaker for the Coding Institute, Parker Seminars, and Foot Levelers, and I'm a guest speaker at many state association conventions nationwide. So now this presentation, we're going to be focusing on audits that are occurring now in a few states across the country. Many chiropractors are getting letters from CMS requesting records. I've had the opportunity to speak to many of the doctors that are getting these requests for records. I've taken a look at the letters, and I want to share with you what I have found out and the answers to some of the most commonly asked questions. So let's go through it. You ready? Here we go. So first, why is Medicare doing this audit? Well, this particular audit, from my research, relates to a 2015 OIG, that stands for Office of Inspector General report, that stated $76 million for chiropractic services were questionable, and then another $21 million was improperly paid due to lack of a primary diagnosis. So that's one of the things we're going to be focusing on in this presentation, how to choose a proper diagnosis according to the Medicare guidelines. Next, there have been other OIG reports that reveal high rates of improper payments for chiropractic services. So I think that's also one of the motivations here by CMS was to, take a look at chiropractic billing. According to their reports, we're not billing properly, and one of the main issues is that we're billing for services that are maintenance in nature and not considered active treatment. Next question. This is what I'm hearing from the doctors I speak to. Why me? Why was I chosen? I have tons of friends that were not chosen. They didn't get the letter. Well, again, based on my research, it appears that this audit is random. I have some doctors that I've been speaking to that say, Dr. Kotler, I think I saw, 8 Medicare patients the whole year. Why are they picking me? I'm pretty sure it's a random audit. Now, there are other types of audits. And by the way, over the last 12 years, I've been part of about 100 audits. So I have quite a bit of experience dealing with audits and dealing with insurance companies that are requesting money and dealing with attorneys that doctors hire to help challenge the appeal. So been doing this, for about 12 years now, and some audits are targeted. There are some audits that are targeted based on the doctor's billing. You could also look at it this way. There are some doctors that collect $1 million a year, and then there are some doctors that collect $100,000 a year. If you're a health plan and you're looking at these two doctors, you're probably going to look at the doctor you're paying out $1 million more than the one that you're paying out $100,000 just to see, hey, what's going on? That's just the way it goes. So the doctor that's collecting $1 million is going to be, that's a targeted review. So there's different types of reviews. There's many different types of reviews, but We only have about, 30 minutes together here. So next question, do I have to send in the information? Absolutely, you must send in the information. That's not even, an issue. If you do not send in the information, then CMS could look at it as a 100% error rate, and they can initiate recoupment for all the visits that you don't have notes on. Because if you don't submit your information, that's your way of telling CMS or any audit, any carrier, anyone. Let's say you're involved in a malpractice case and they say, could we see the records? And you go, not sorry, I don't have records. I'm not submitting them. Or a patient files a complaint against you with the state board. The state board is going to ask you for your records and you say, sorry, I don't have them. Or you say, well, I had a power failure and I had a situation where my system shut down and I lost records. Be careful with that. If you're saying, well, I don't have the records because I had a computer malfunction and I lost all the records, oh, wow. So did you have a backup in place? And you say, no, I didn't have a backup. Well, now this is leading to a possible HIPAA violation that you may have lost information and this may have turned into a breach, so careful with that. Next, do my patients need to sign an authorization to release the records? If I provide Medicare with my patient notes, isn't that a HIPAA violation? No. You do not need to obtain patient authorization. Releasing the information to CMS is not a HIPAA violation. It's actually discussed in the correspondence that you received. Next. Some of the doctors I'm talking to say, Marty, it's a lot of paper. I was asked for 40 visits on 35 different patients. It's a lot of time and effort to pull the files, review the files, and make copies and then send the information. Can I charge for this? Unfortunately, no. CMS states that they are not authorized to reimburse providers for the cost of copying, postage, or records. Now, can you charge the patient? No. It's the cost of doing business, unfortunately. Next common question. Dr. Kotler, I got the letter. The top of the letter says, Attention Compliance. Attention Compliance Department. Does this mean I need to have a compliance plan in place? Well, according to the Affordable Care Act, providers that treat Medicare patients are required to have a compliance manual with written office policies and procedures, train staff members on policies and procedures, and keep a log of all staff trainings. I hope it doesn't become an issue where you're asked for, a compliance manual and you don't have one. If you have one, great. You could sleep well at night. You don't have to be concerned if you have a compliance manual with your policies and procedures. And the goal of it is to prevent billing and coding errors. That's the main reason for having an OIG compliance plan. It's different than HIPAA. Next, the letter requested many items to submit. So I'm going to cover a few of these. So here's the first one. It says, submit records for all dates of service on the claim. All right, so take a look at the claim that was submitted with the date of service in question. Is there more than one date of service on that particular claim? So let's say you were asked for March 15th of 2014. You were asked for that date of service. By the way, and I've been speaking to a lot of doctors about these audits, and it seems as though every doctor that I've spoken to, the dates of service in question are from 2014 and 2015. So let's say they're asking you for March 1st of 2015. Take a look at that claim. If that claim also had March 2nd and March 3rd, you may have to submit that one. If it had the date prior. Maybe it had February 28th, the day before the date of service in question on that claim. You may have to submit those. Each set of patient notes should be evaluated on a case-by-case basis to determine what information should be submitted. Next thing it says, initial and subsequent visits. Again, look at the date in box 14 now. Okay, now we're looking at something else. Take a look at the claim. The prior situation was the dates of service on that claim. Now, take a look at the date in box 14. So let's say the date of service in question is March 1st, 2015. Take a look in box 14. Let's say box 14 says March of 2012. You may have to submit the dates of service subsequent to the date of box 14 through the date of service requested. Now, I'm not 100% sure if they're looking for all subsequent dates of service from the date in box 14 or just the date of service on the claim with the date of service in question. So that's where you can call them. Many of the doctors that I've spoken to have actually called and inquired and have gotten the answers to some questions. So you may want to do that. Now, box 14 is very important. Now, many of the doctors that I'm working with were addressing the present issue and gathering the records and sending them in, but simultaneously while I'm working with these doctors and staff members, I'm educating them as to what to do moving forward if they weren't doing things right in the past. Like some doctors say, Marty, I never changed the date in box 14. It says 1986 in there. You know, I don't see how a health plan could request money back just based on the fact that there's an old date in box 14. What do your notes say? If your notes say that the patient had a recent exacerbation, a recent evaluation, a new problem, you started a new condition with a new episode and a new plan of care recently, then to me that should supersede any glitch or issue that was in box 14 that had an old date. But, you know, we'll see how it's interpreted. But moving forward, here we go. Here's box 14 on your screen. It says date of current illness, injury, pregnancy. So if Mr. Miller walks into your office today, a brand new Medicare patient walks into your office today, put today's date of service in box 14. Now Mr. Miller gets a series of treatments, and then he's discharged, and then he reappears a few months later with a new problem or an exacerbation of the old problem. Then you put that date where he came in a few months later in box 14. And there's also a qualifier for the onset of current symptoms or illness. That is identifier 431, which Medicare, last time I checked, doesn't require, but many systems automatically populate that qualifier in box 14. Other items that is mentioned in the letter, progress notes, including relevant history. Now, the term progress notes is not really used that often in chiropractic. Now, those of you that have integrated practices where you have physical therapists seeing Medicare patients, that's a common term. Progress note with a Medicare patient being seen by a licensed physical therapist is done every 10 visits. And there's other items like the functional reporting and other items that physical therapists are required to do. But in chiropractic, we do reevaluations at certain intervals. It's a little different, but my recommendation is provide any exams, re-exams that could help support the medical necessity for the dates of service in question. Treatment record, including the plan of care. The plan of care should include, now for those of you that haven't been doing this, start doing this as soon as possible. Your plan of care, that means after the initial visit with your Medicare patient, your documentation must show a chief complaint, a description of the present condition, the part method, subluxation as the primary diagnosis, the frequency and duration of care, the goals to be achieved, and the objective measures that are going to be used to evaluate and monitor the effectiveness of chiropractic. Next, ensure the medical records submitted support the service is active treatment. See, that's one of the big problems that the OIG has found in their reports, that chiropractors are billing for active treatment when the documentation shows it to be otherwise, like maintenance care. So the Chiropractic Medicare Guidelines, or the LCDs, provide details on active treatment. When submitting claims for reimbursement, active treatment is designated by the AT modifier. Claims submitted without the AT modifier are going to be automatically rejected. Next, signature of professional providing the service. So every note must be signed, must be legible, and must include your credentials. The note can be hand-signed, or if you have certified EHR software, an electronic signature is accepted. If your notes do not have any signatures, you're having a problem with that, let us know, contact us, and we can supply you with something called an attestation. It's a form that you would fill out that attests to the fact that you actually saw the patient. Very common form. If you need one, let us know. Send your emails to amy@targetcoding.com. If you have any questions, if for some reason you think of a question after today's presentation, no worries. Just email amy@targetcoding.com, amy@targetcoding.com. Copies of any patient notices, example ABN form. If you provided chiropractic spinal maintenance care, then you should have an ABN form signed and on file available for review. We're going to get to the ABN form in a few minutes. Any abbreviation keys or acronyms used. If you use unusual, non-standard abbreviations, you must submit a key describing your abbreviations. Next. Okay, so those are some of the items that were mentioned in the letter. Now let's go to some other common questions that are coming in. Can I make changes? Can I make changes to my notes once they've been entered into the record? No, absolutely not. Should I say it again? No, absolutely not. Now, if you look at your notes and your notes don't appear to paint the picture that you'd like to paint, then you could put something together called, I call it a treatment summary. Other people call it different names. I call it a treatment summary, and you date that today. Remember, Mrs. Jones is a patient of yours, and you were requested for a date of service on Mrs. Jones from March 1st of 2015. It's a couple of years ago. Can't go back into that note and make any changes. This is my recommendation as a certified coder and a certified compliance officer. You shouldn't go back and make any changes. But if you wanted to put together a treatment summary, date it today, even though the services were rendered 2 years ago, and tell a story, I feel that is helpful. And many, many people agree with me. Many attorneys agree with me. Actually, an attorney many, many years ago was one who recommended their clients put together treatment summaries when submitting claims. So a treatment summary could help explain your treatment approach, clarify any vagueness, and point out the most important parts of your documentation to help support medical necessity. Next question. What's going to happen after I submit my notes? Well, when the review is complete, you're going to receive a letter of determination. The results letter will stipulate if any underpayments or overpayments were made. In addition, you may be subject to extrapolation. Extrapolation is a scary term because if they find some companies, it's not too common. Again, I've been part of over 100 audits over the last 12 years. It's not too common where a health plan will apply the error rate to the entire universe of patients for a certain period of time. So hopefully you won't be subject to extrapolation. What's going to happen after I submit my notes? I'm sorry, we covered that. So a couple of things here. I want to start giving you some ideas to prevent penalties and prevent problems. So I've put together a few things here to prevent. You know, chiropractors in general are into prevention, right? I think chiropractic profession is more about preventing problems and is more about the overall health of a patient and wellness and making them less susceptible to problems in the future is what most chiropractors do, where we take a holistic approach. You should be taking a holistic approach towards your records. You should take a holistic approach towards your documentation and try and always prevent problems from happening. So you need to be proactive. Medicare expects you to know. Like there are many doctors that, you know, have done some things that they said, Marty, I didn't know, or I was told by Medicare. This is what I'm hearing by a few doctors. Marty, I went through an audit 10 years ago with Medicare, and they told me to do this, and I've been doing it. And now, according to the experts and Medicare, that's not correct. You know, so Medicare expects you to know. Whatever happened in the past, you can't necessarily assume that's going to be applied now. I was speaking to another doctor recently. He said 4 years ago he went through a Medicare audit and his notes he didn't think were good, but he passed the audit. So he thinks, I'll just keep doing my notes the same way because it worked. Now, you could have a different reviewer. You could have different policies and procedures. Here's another thing. I've seen horrible notes pass audits. I've seen fantastic notes fail audits where the doctor had to appeal it. So you want to be proactive. Medicare expects you to know, can you provide proof that you've made an effort to prevent fraud and abuse? So if you are questioned not only by Medicare, by regular insurance too, let's say Blue Cross Blue Shield asks you, doctor, do you make efforts to prevent fraud and abuse? What steps do you take to prevent billing and coding errors? Now, you might say, well, we train our staff and we go to seminars and we read the Medicare LCD. Okay, is that in writing? Do you have anything in writing? Because you could say whatever you want. If it's not in writing, then how does anybody know that it really happened? It must be in writing. You never want to be accused of willful neglect. That means it's reckless indifference. You're just really not doing things right. Like I've spoken to a couple of chiropractors. They say, Marty, I treated this patient over 200 visits over the last 8 years. Is that okay? That could be looked at as reckless indifference. You're just not following any of the guidelines, and you should have known. You see, that's another problem. Willful neglect means you knew or you should have known, but you didn't do anything about it. So establish a protocol for active treatment. Have patients sign your HIPAA notice of privacy practices. Have it available for review. The proper delivery of the ABN form if you're ever questioned. So here's a quick crash course in ABN. Here's what it looks like blank. Here's what it looks like filled out. The purpose of an ABN form is to notify a patient that a normally covered service, what's the only thing that's covered in the Medicare program when performed by a chiropractor? Spinal manipulation. So there you go. Connect the dots on that one. The only time that it's mandatory to use an ABN form is when the spinal manipulation is now not going to be covered. So you wouldn't do this on the first visit. So the ABN form is used when the patient gets to the point where they've reached maximum improvement, or you're going to deliver a spinal manipulation and for some reason it's not going to be covered. The main reason why? Maintenance care. So here it is on your screen, your name, address, phone number across the top, the patient's name, the services, maintenance care, reason Medicare may not pay. Make it very clear. Medicare doesn't pay chiropractors for a manipulation of the spine for maintenance care. Make sure you put in how much you're going to be charging the patient. Very important that it's on the form, how much you're going to be collecting from the patient, and then leave the rest of the form alone. The patient has to choose an option box. If they choose option 1, now you have to bill Medicare even though it's not going to get paid. Option 2, it says do not bill Medicare. Make sure the patient signs it and dates it. Now, some of you may be thinking, well, what about the first visit, Dr. Kotler? On the very first visit, we use an ABN form. Is that okay? Yeah, but I don't recommend it. Let me repeat. Is a ABN form, well, I mentioned earlier, an ABN form is mandatory when you're about to deliver a service that is normally covered by Medicare and now it's not going to be covered. Spinal manipulation is the key reason. Now, you're going to do an examination on a patient. Do you need an ABN form? Some of you may be using an ABN form for exams. Well, according to the laws on the ABN form, it's not mandatory to use on a non-covered service. So that's why I recommend this form you see on your screen. If anybody would like a copy of this form, this basically says on the very first visit, Mrs. Jones, Medicare doesn't cover exams and x-rays and therapies. Don't put spinal manipulation on this form because it's covered, right? You want to keep them separate. Mrs. Jones, Medicare doesn't cover exams when performed by a chiropractor and x-rays and decompression. We also sell vitamins. Medicare doesn't cover that. And the patient acknowledges it and they sign the form. There's a strong acknowledgement here. I acknowledge I've been told in advance that the services and items listed are not payable by Medicare and I agree to pay for these services. I've had ample time to ask questions. I acknowledge that I'm signing this notice voluntarily. I understand I have the right to refuse care and that by signing this form I'm fully responsible. So I recommend this. Now, if you say, Marty, we want to use an ABN form on the very first visit, okay, but understand what you need to do. You may have to use modifiers. You may have to do some other items, and it might not necessarily work out. For example, if the patient says, do not bill Medicare for exam, but the patient has a secondary and they check option 1, now you're going to have to explain to the patient that they're not going to get reimbursed for the exam. So it can get complicated. Now, another thing that I recommend you do as part of being as compliant as possible is to do a self-audit. Do a self-audit. Take out a couple of Medicare charts. We recommend 2 charts be reviewed every 6 months. That's 4 charts per provider per year. I don't feel like that's overwhelming. 2 charts per year. Take a look. This is a little checklist we've created where, you know, we score our clients. We have this little spreadsheet, and then we take the number of answers that were completed divided by the number of yeses times 100, and then we get a score, and we go through all the bullet points, and we just go down and mark yes, no, and it's a very nice audit tool. We do it with our clients that are interested in doing it with us. All right, so more action steps to prevent penalties. Again, we're into prevention as chiropractors. You should be into prevention for your practice. How do you prevent problems in your practice? Read your local Medicare guidelines. Review the guidelines with your staff and log the training into your office policy and procedure manual. Attend seminars. Attend webinars. Like this webinar, you should have a compliance manual. Well, just take out a piece of paper. If you don't have a policy and procedure manual, start one today. Take out a piece of paper. Put at the top of the paper, Medicare training. Attended a webinar by Dr. Marty Kotler, Certified Compliance Officer. 30 minutes attended by whoever's in the room, whoever's watching it with you. Have everybody's name printed. Then everybody signs next to it. Date it. There you go. Now if somebody comes knocking on your door, you could say, wait, we attended this webinar. It's something. So start documenting every seminar, every webinar that you go to. Watch videos, read books. Get your Medicare notes in general, even your cash patients, get those documentation records reviewed by a certified coder that specializes in chiropractic. I say 5 years experience would be nice. A chiropractic OIG compliance manual can prevent audits and payment recoupment. If you see Medicare patients, Medicaid, TRICARE, or any other federally funded program, an OIG compliance manual is recommended. So let's just go through a few closing comments. You must check with all the carriers you bill prior to submitting claims based on the information presented in this presentation to ensure that it is compliant. Target coding does not guarantee that this information will guarantee payment from any insurance plan or patient. Target coding is not responsible For any insurance carrier or managed care organization laws, rules, guidelines that may change following this presentation. So it's important to do your best to stay on top of these changes. Attend seminars, attend webinars, join your national and state professional associations. Here's our contact information. Email is info@targetcoding.com. Website, targetcoding.com. Telephone number is 1-800-270-7044. Fax, 1-844-831-2347. Now, before we get to a few of the questions, let me just share a few things here that we do at Target Coding. One of the things that we have is a book. This is a terrific book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. So when it comes to diagnosing your Medicare patients and patients in general, we have a list of diagnosis codes. One section of the book is clinical tests and findings to support common ICD-10. So, for example, you diagnose a patient with cervical brachial syndrome. Make sure your notes show that you did Wright's or Atson's or some upper limb tension tests. You checked reflexes, you checked for myotomal weakness, you found forward head carriage, you found numbness and pain radiating down the arm. So we have these common diagnosis codes and the ortho, neuro, and chiro tests to support it. The book also has these cheat sheets, or I call them quick guides, on the long-term, short-term, and moderate-term treatment diagnosis codes and how they link. Another thing we offer is an OIG compliance manual. Obviously, that's one of the things that we specialize in. So a OIG compliance manual. You may have a HIPAA manual, but now you should have an OIG. Most HIPAA plans do not include OIG. So if you have a HIPAA plan, proud of you, great. Now add an OIG. Our OIG compliance manual is a comprehensive, customizable manual. Policies and procedures are personalized for your practice. We give you chart audit tools and corrective action plan guidance if needed. We give you sample training logs, incident report forms, employee attestations. We provide you with OIG articles and links and referenced material. Now, if you're looking to do a HIPAA compliance program, you've come to the right place. Shop around. Our HIPAA compliance program is different. It's unique. If you're the type of person that, let's say, you file your own taxes, then you may be qualified to do your own HIPAA compliance program. Those of you that want to outsource it, there's many different programs. Ours is a premier concierge type of service. We do most of the work for you. We put the manuals together for you. We train you. We show you everything that you need to know. It's very comprehensive. We provide a comprehensive security risk analysis. We provide a cloud-based storage portal for all your HIPAA policies and procedures. Everything gets uploaded into one area. You could print them out and put them in a 3-ring binder if you like a hard copy. If not, they're uploaded, ready for you at any time. We offer compliance training videos, HIPAA compliance testing with certificates of completion, business associate tracking. And you also get cyber liability insurance. You're going to hear more and more about cyber liability insurance. If you have a friend or a neighbor that sells insurance, they should get into that, in my opinion, because I'm hearing more and more about cyber liability insurance. Well, Target Coding's HIPAA compliance program includes $100,000 of cyber liability insurance. So for some reason you have an issue, some reason you have a breach, and you have to hire an attorney that costs you $10,000, let's say, this program may cover you. What else? Yes, this is also part of the book. It shows you how to pair your CPT codes to your diagnosis codes. So if you're going to do therapeutic exercises in the cervical region, we have a whole list of diagnosis codes that you should be using. And then we also have long-term, short-term. We also offer seminars. We have a seminar coming up in New York next week. followed by a seminar in Florida on personal injury and cash patients. The New York seminar is approved for 6 CE credits. So we have a whole bunch of seminars. Most of them are approved for CEUs. We have webinars, many also approved for CEUs. We also offer memberships. See, what I have done with my company is offer just about anything for any chiropractic practice in the country. We have something as little as you could hire us for an hour to do some work with you. You could buy a book for $99 and up, or you could have a full-blown HIPAA compliance and chiropractic billing and coding compliance program with an on-site visit done. So we've covered all bases. We like giving choices. You ever go into a restaurant where the menu has a lot of things? That's what we like. We like a lot of choices. And you pick what's right for you. We have a basic membership, $99 a month. Stop and start at any time. Pay as you go. And then we have a platinum membership. And then we also offer a free, for those of you who just want to chat with us, free 15-minute coding and compliance evaluation. We've done a lot of these for this particular audit. Again, here's our contact information, email info@targetcoding.com, website www.targetcoding.com, telephone number 1-800-270-7044, fax 1-844-831-2347. I want to thank everybody for attending. I hope you learned a lot and this was helpful.